The Southern Nevada Public Health Laboratory was established in 2002. Until that time, Las Vegas was the only major metropolitan area without public health laboratory capacity within 100 miles. The Public Health Laboratory now provides vital services to our community of more than 2.2 million residents and the 40 million visitors that come to Clark County each year.
The Southern Nevada Public Health Lab contributes in many ways to protecting the health of the community of Southern Nevadans. My name is Cassius Lockett. I'm the District Deputy Health Officer of Operations with the Southern Nevada Health District.
Yes, my name is Hong Yuan Kan. I'm Laboratory Director of Southern Nevada Public Health Laboratory.
During COVID, our Southern Nevada Public Health Lab did almost 400,000 or 500,000 tests in the community, saving us millions of dollars.
From COVID-19 and sexually transmitted infection testing to investigating TB outbreaks, foodborne outbreak investigations, emerging diseases, and identifying viruses in mosquitoes, the Southern Nevada Public Health Lab is an important component of our public health system. Its daily activities are integral to supporting the Southern Nevada Health District's investigations and surveillance activities.
Our laboratory performs more than 50,000 HIV, syphilis, hepatitis, and the TB tests annually to support the disease control and prevention activity of SNHD in Clark County.
We get reports of suspected disease from community doctors, for example, but they have to be also coupled with and paired up with a positive laboratory confirmed result. So when we get that confirmed result in the community, our disease investigators work very thoroughly to investigate that, mitigate the disease spread, make sure people are treated in the community. Can't do that without the laboratory results.
This is our area where we do our surveillance. We have a surveillance program with the coroner's office currently right now, and we do respiratory surveillance through those samples that they go ahead and collect. We run it's an RP panel, and they're able to identify various viruses. We're looking for influenza, we look for RSV, as well as various other organisms in that surveillance. And we go ahead and give those reports back. If our epidemiologists at SNHD get a report of somebody complaining about illness, then if we're able to go out and get a sample from that individual, they'll collect a sample and we'll run it here. And then if we're able to get another person that was maybe at the same restaurant or maybe at the same party, or even sometimes schools, there might be some kind of outbreak investigation going on there, we'll go ahead and get those samples and pull them in here. We also do sequencing on those, and sequencing is you just basically get more information that you're able to get not necessarily in the traditional way of testing, and it basically gives us more information in the sense of, is it the same thing? As you guys know, with the pandemic, we had to vamp up our lab and change it a lot. We had only one lab originally, and this was the floor. It was all on the second floor, but now we're the whole building. So, and pretty much COVID and whole genome sequencing and molecular testing are done on the second floor.
So currently we're testing all sorts of STDs, as well as basic chemistries and CBCs, which is your hematology. We test in all the patients that come into the clinics at SNHD, as well as some other clients outside of SNHD. It's mostly for STDs, so chlamydia, gonorrhea, syphilis, and HIV. We also do a bunch of tuberculosis testing due to the recent outbreaks, as well as hepatitis.
Over the next 10 years, we anticipate an increase in emerging infections, and that's due to a variety of factors, but the primary factor that's going to drive this is going to be climate change.
The Southern Nevada Public Health Lab plays a crucial role in supporting public health initiatives related to monitoring diseases and managing outbreaks. Currently, the size of the Public Health Laboratory, which was built inside a repurposed warehouse, is inadequate for future planned growth and essential operational enhancements.
Currently, we have insufficient laboratory test space.
Plans for the new expanded laboratory will allow the Southern Nevada Health District and the Southern Nevada Public Health Laboratory to support neighboring rural counties, prepare for future pandemics, mitigate problems associated with sending tests to outside laboratories, and support the future growth of our community. For more information about the Southern Nevada Public Health Laboratory, go to the Health District's website at www.snhd.info.